righting the wrongs of social injustice, helping the disenfranchised, providing access to health care for everyone, no matter who they are or where they live. These individuals are Doctors Frank, Shank, Schwartz, Chadwell, Myers, Fulgenzi, Brother Jerry. Long before this was even, that's the true history of this clinic. But in 2007, I was sitting in my office in family medicine, and Dr. Shank was the chair at the time, and she came to me and said, Tyler Southwell, who was president of the Senate, was speaking to her about starting a free clinic. And there's a national meeting that I go to every year, and by happenstance, they were having a day-long pre-conference workshop about student-run free clinics. And she said, I'd like you to go to this. And I always say yes to Dr. Shank, because it'll always be a challenge and it will never be dull. Always interesting. So I said, of course, yes, love to go. And Tyler Southwell and I went to this conference. And I said, Tyler, you tell me what you want me to do. They had breakout sessions, so I went to starting a free clinic, how to fund a free clinic, what's the faculty's role, what about other learners. And we walk in the opening session, and there's 200 medical students in this large conference room. And we had to introduce ourselves and say that what student-run free clinic we were from. And students were standing up saying they were from UCSD and the J. Dot Clinic in Kansas, and Hope's Clinic in East Virginia Medical School, Einstein, Stony Brook, South Carolina. And students were saying, in our communities, there's such poverty, people need free health care, there's such disparity. Tyler and I looked at each other and said, come on, we gotta do this. This is Detroit. Wayne State is gonna be all over this. We're doing this. We were sold. I was exhausted at the end of that first day of these long meetings, excited and overwhelmed by every detail that was coming up. We came back very excited. Meetings with Dr. Shank, Dr. Rowe, what can we do, how can this happen, we want to do this. And Tyler was graduating then, bringing on new leaders, and Rob McWhorter and Dorothy Gottlieb, who said, yes, I want to do this. Around the same time, there's a primary care research network that Dr. Schwartz founded called MetroNet. And one of the clinics is this clinic, Mercy Primary Care, which is a clinic that's celebrating its 10th year here, this year, of serving the uninsured here in the Detroit area. And I came and took a tour. Met Dr. Myers, was very impressed with her. Ms. Williamson, the administrator. We were sending MPH practicum students here, getting more involved. Our department adopted this clinic and its showering program for our own giving as a department, which we continue to this day extensively. So we had meetings, and there was other names popping up. Remember when we used to meet in the lab at Scott Hall? Don was there, Brandon, Bill Smith. Meetings in those lab rooms in Scott Hall, meeting after meeting, meeting with Dr. Shank. Where can we have a clinic? We need a site. Mercy Primary Care. We approached Mercy Primary Care, and they said yes. All kinds of committees, fundraising, let's have a fun run. Then we went to the second annual conference because new leaders were coming along. This was Birkin and Yara. We went to the second conference. We were now a national organization. It was adopted that first year. We were a Society of Student-Run Free Clinics. We were going to have this meeting every year. I go to the second year, and the attendings were coming up to me going, Wayne State opened their clinic? I said, no, not yet. Being impatient, wanting this to happen, trying to keep the morale of the students going because we couldn't see it. We couldn't visualize this. Dr. Rowe became involved. More leadership developed. Jessica, Christy, these names are popping up. Lou, Brittany. More leadership coming up. More student involvement, planning, and a long, long the long process of an affiliation agreement between the School of Medicine, the lawyers, Trinity Health lawyers, which oversees Mercy Primary Care. Even though there was no money involved, this is free. We pay no rent here. There's insurance issues, malpractice, indemnity. Finally, that was all worked out again through Dr. Schenk saying, let's get this done. And pushed it through, and you did. And
yeah,
we
on the
appreciate
first
that.
day of clinic.
Yeah. We then went to the third conference with Reza and Malik. By that time, we saw where we could be. We were in here, looking at our space, figuring out which rooms we were going to be using. We could now see it. We could see the light at the end of the tunnel. And we went to that third national conference, and they said, are you open yet? And I said, no, but we will be this May. I promise we're going to be open this May. And indeed, as it got closer and closer, we were on pins and needles. This was January, February of a year ago. Come on, we're going to open. And Malik and Reza, Yara, Birkin, all the leaders, a lot of deeply committed students to this initiative. It opened on May 26th of 2010 to great success with Brother Jerry and the Capuchin Soup Kitchen saying, you know what, we'll bring you the patients. And they did. This year, we attended the 4th annual conference with 5 Wayne State students. They took our group picture because they said, whoa, you sent a lot of students. We now have representation on the National Student-Run Free Clinic Committee to plan next year's conference. And I said, yeah, Wayne doesn't play. We're involved, we're in now. And I loved it that the attending said, is Wayne open? I said, yes, successfully. And through all the pain of the laborious planning, and I know the students got frustrated, but you know what? We had to do that. It was very important. Because what do we get complimented on when other students start here? It's so organized. It's so smooth. The preceptors are amazed. This functions so well. Through hard work, careful planning, committee structure, fun runs. Another successful one we just had. So, now we're here to this day at our first year anniversary, close. And I want to close by saying the students at Wayne have a saying that if they get mistreated or they don't get what they want by staff, administration, or faculty, they say they're getting waned. They've been waned. And I'm going to change that definition today. I want to say to the administration, to Dr. Frank, Schenk, the faculty who are here, Dr. Myers, our community partners, Dr. Fulgenzi and Brother Jerry, our patients, all of you students of the Student-Run Free Clinic. We are seeking and helping the disenfranchised. We are righting the wrongs of social injustice in the Detroit area. We are providing access to quality health care for those who need it the most. So I'm here to tell you, yes, you have been waned. Congratulations, enjoy it.
It's tough to follow, but I'll do it. Dr. Treadwell, if you'd like to say anything and add to that, you're right.
He asked me like 2 minutes before we started. I appreciate it. Mine is only 7 minutes.
Oh.
No, just kidding. What to say? I really was I have the same feeling about this place, even though I didn't come to it until really June of last year. And just like Dr. Brianna said, you don't say no to Dr. Schenk. And Dr. Schenk approached me about this and said, you know, I want you to do this. I really didn't know anything about it, and I'm so glad that you did ask me because it's just been really a privilege. I remember the first time walking in this place, and I was amazed how nice this facility is, and I just thought this is wonderful. And I saw the students, and they just came together. And so I really want to just focus on two things, the students and the preceptors. But the patients are great, thank you. But the students really amaze me, and I think the fact that they have taken ownership of this in the way that they have is just, you know, I worked with residents for many, many years, and coming here and seeing students do what they do just floored me, really, the first time I was here. They were able to see patients so efficiently and organized, and Reza is standing back there with his camera. I think he did a great job really in the first year being the sort of the go-to person for everything. Anything I had a question about, I would go to Reza, and he would help me out. So. And now Cyrus is really, we've met the last, what, 2-3 days, we've been like seeing each other, so we're getting tired of each other, but we were out in Houston together too, and it's just, again, the energy, this place makes me remember why I went to medical school. I'm a Wayne graduate, and really, this brings it home for me. So, another word to the preceptors. I don't see Dr. Schwartz. Dr. Schwartz. She's hiding in the back. Dr. Schwartz, this would not have been possible without Dr. Schwartz's support. I really want to say that because, you know, she's very humble in that way, but I just want to say that because without the students doing their part, but also the staff, you know, being here, in our department, she has really rallied the department and really set the standard for preceptors coming here. It's really been a pretty small group because we wanted to build that quality, that continuity, really know what we're doing before we kind of open it up wide to other preceptors in the community, which we're now ready to do as of June. So again, thank you very much for your support. Really appreciate that. And thanks, Dr. Schenk, for letting me be part of this.
Thank you very much. Well, I'm going to draw our focus back to the patient for a minute. I started out my practice career with the Public Health Service in rural Virginia, and at the end of the day, it is all about the patient. And what we do is create the infrastructure and the protections around the patient. And I remember in many meetings with Reza talking about the checklist. Reza, I want a checklist. I want to know that when a patient walks through their door, that we know what we're doing and we're able to step up and help that patient in any way they need that help. Why? Because we can be present with the patient. We don't have to worry about, is the room clean, is this there, is that, you know, is the lab staffed appropriately. You all have done it. Congratulations. I know it was a laborious 2-year planning process for which I felt like the biggest obstacle. But it's because I've opened these types of facilities before, and I know it is all about that. So it's about the patient and what you're able to do. The other thing about this free clinic that really I was in when Tyler talked to me is because he presented it to me as a continuity care situation for the patient. This isn't a one-off. This isn't a walk in the door and give some medicine and out the door and never see the patient again. This is about continuity. It's also for the students about continuity of care for you with your patients. So again, the organization that you're doing with Brother Jerry and the facility and everyone who's engaged in your teamwork is so the patient becomes familiar with a team of physicians. And I know some of you have had the experience of what patients will tell you when they're comfortable with you. And it's quite amazing what they share with you about their lives and what you can do for them because you have a wealth of experience. And then finally, the attendings. You know, we've kept this very close in family medicine because we know in family medicine how to say yes. Anybody can walk through that door and you've got an attending that can help you take care of that patient. It's all about the yes, and it's all about how you can be there for the patient. I am extremely proud of all of you. I was thrilled to have Dean Frank be the embodiment of this clinic as it moves forward. I trained with Dean Frank. He taught me this when I was a student, and I live it. I think about it every day, and I try and live it with what I do with the students, but obviously how we care for the patients here. So I thank you for the opportunity to say a few words, and congratulations.
This green right here, that's a checklist.
The checklist.
The order of things I need to do.
I see it's improving.
Color coded, it's actually very beautiful. Okay, if we'd like, Dr. Fogetti would like to give a few words.
Hi, I'm Dr. Kathy Fulgenzi. I'm a 1979 graduate of Wayne State University, and I've had the privilege of practicing family medicine on the east side for the past over 25 years. My mom grew up in the Parkside Projects, which is right around the corner from here, so I have long-time roots on the east side. Once upon a time, I was a young, impressionable, somewhat idealistic medical student who had a vague idea that I wanted to serve the community, and I was fortunate enough to encounter a group of young physicians at the old Detroit Receiving Hospital downtown called the Bethune Collective, that were some very bright young men and women that probably could have gone into any subspecialty field in wealthy areas, but that all decided to go into primary care medicine at Detroit General to serve the inner city poor. And they really taught me a lot about what it means to be a physician serving the community, to see the dignity and worth of every person, no matter what their circumstances. And I think that this clinic is carrying on that tradition to the next generation. I'm really glad to see it happening, and I think there's no better person to name it after than Dr. Frank.
All right, so I just want to mention, this, again, wouldn't be possible with the students that took the initiative to get this started. And I'd like to have at least a few of them walk up, and I had Amanda talk to her about speaking as well. Amanda Osteen and Robert McWhirter.
I also was asked to speak just prior to us starting this, so I don't have anything, written out, but it is really amazing to see all this come together. And even today, through your third year, you don't really know your schedule more than 2 to 3 weeks in advance, so it's hard to always give a date that I can be here. So sometimes when I'm not here, more and more people have been accumulating. When I walked in this morning, I didn't even know more than half of the medical students, which is amazing. That's just saying, while I've not been able to be here every time that the clinic's open, more and more people are getting involved and are excited about our project. And as I was explaining to Reza, when we first started this, I know it started with Tyler in the class before me. I'm a third year, but we had huge committees. We were meeting in the labs maybe once or twice a month. We had these huge committees, and we didn't really have this, this concrete idea of this clinic. It was very idealistic. We wanted to get it done, but it was just, we didn't see this clinic. We couldn't see the hallways. We couldn't see the patients. And so I think a lot of people did become a little, they didn't have the idea, so they started getting off course. And some people did end up not coming all the way through the clinic. But the people that have been so committed, and with Rob and Dorothy, who's no longer here, but we have Yara and Birkin who aren't able to make it, but it's been really, their leadership has been fantastic, and it's really just been so amazing to be a part of this. And when I even explained to my family, what are you doing this Saturday? I'm like, I'm going to be at the free clinic, and they're like, well, what can you really do? We're seeing them in the continuity care setting, but we can also offer the lab, and we have social work. That's amazing. A lot of clinics that are run with government funded money don't even have stuff like that. So this has just been so great, and I'm so proud of everyone for stepping up to the challenge. And I know that the patients really appreciate it. So it's been really great, and it's been a really great process going from planning to seeing it in reality. So that's great. More
mimic and reflect everything that she said. Dr. Bianyanda did a great job of describing the history. The only thing that I would add to that is that this entity now, it actually started, I was in the Student Senate in my first year, it actually started as an ad hoc committee in the Student Senate, so it wasn't even like a real entity. There was 3 of us. There's Tyler Southwall, one other, Kate Gerchak was the other Sorry?
I forgot Katie, I'm
Yeah.
sorry.
And so the three of us that brought the idea to the faculty, and there was a point where all these meetings were going on and stuff where the students started to lose a little faith in the process, thinking that it was going to fizzle out because we were getting kind of roadblocked with the legal aspects of the thing. But that's when Dr. Shank stepped in, and she really brought it along, and she deserves, like, for the most part, the full credit of making this clinic actually happen. That doesn't discount all the other participation for the faculty. Dr. Myers was tantamount in making this happen, along with Aissa going through the process administratively. But Dr. Shank really brought it along. I really appreciate your efforts in making it happen. I know you have a lot of passion for this type of thing, but it was really great. It was exactly what we needed.
Yeah, but, you know, it's a partnership. I mean, I appreciate that, but you see this? We're really one. No?
I'm going to be leaving, Wayne's staying out, moving on.